Hi everyone, it's Dr. Adam Dreisman here, and I want to talk to you all today about pain medications and pain control after your total knee replacement. So there are a few medications that I'll give to all patients after a total knee replacement. And granted, some of these medications might differ slightly based on individual preferences, but I just wanted to give you a broad stroke overview so you had a sense of what medications you should expect to be taking. The first medications I want to discuss are the blood thinning medications. These are medications not necessarily for pain, but to try to thin your blood so you do not develop any blood clots after the operation. The vast majority of patients, unless you have a prior history of a blood clot or a hypercoagulable state, the main medication I'll give is a baby aspirin twice a day. This medication you'll take once in the morning and once in the evening to be able to help thin your blood. If you do have a history of being on any blood thinners or having prior blood clots or having AFib, you potentially might be on other blood thinning medications like Eliquis or Xarelto, and I'll make sure to specify this to you all so that you know that those are the medications that you take to prevent a blood clot. Now, when talking about actual pain medications, the ones that I will give to all patients typically are extra strength Tylenol. This is 500 milligrams, and usually I recommend about 6 doses a day. This is below the full dose medication, but enough to help provide some anti-inflammatory effects to decrease the amount of inflammation in the knee that results in swelling. Another medication that I'll prescribe typically is a strong anti-inflammatory called Celebrex. This medication is good compared to other anti-inflammatories as it has less GI upset associated with it, but this is a medication that I want you to take, again, to decrease the amount of inflammation and swelling into the knee. In combination with that, I will also most likely prescribe some sort of muscle relaxant or some sort of medication to decrease some of the nerve pain after your knee replacement. Those two medications I discussed though, Tylenol and Celebrex, I want you taking every day no matter what. They're not as needed medications, but they're standing medications, so you should take those medications on a normal schedule. The as needed medications that I'll be prescribing to you, one of them is gabapentin, which is a nerve type pain medication, and the other one is a narcotic medication, oxycodone or sometimes tramadol. The gabapentin typically is prescribed for nerve pain, but has been described in the literature to help reduce pain in other circumstances too. And again, this is as needed, so I don't want you taking this every day if you don't feel like you need it, but if the pain gets worse, you should take one of these medications. And again, the last medication I want you to take is one of these narcotic pain medications because it does have side effects associated with it. Some of these side effects include nausea, vomiting, dry mouth, constipation. So this is really a last resort medication, and I'm really hoping that you'll take less than 10 of these after your knee replacement. So I briefly also just want to touch upon the normal spikes of pain that you would expect to feel after your knee replacement. The vast majority of our knee replacements are done under a block, meaning that the anesthesiologist and myself will give local and general blocks around the knee that should hopefully be in place for anywhere from 24 to 36 hours. So usually I have most patients say at around 36 hours, that's when they feel like the storm hits. I don't want you to be worried at this time because this is very normal. So the first thing you should do when you feel the pain go up during this time, rest, stop your exercises, lie down and elevate, and put ice on the knee. Wait 20 minutes. If that still doesn't help with this pain spike, then go ahead and take a gabapentin medication. Go ahead, put ice back on for 20 more minutes, and again, if the pain is still present, then you can go ahead and take one of the last resort oxycodone or narcotic pain medications. The next pain spike I usually expect to see is usually around 4 to 5 days after the operation. That's when some of the longer blocks really start to wear off, more about 72 hours to 5 days. At that point, again, same thing. When you feel the pain spike come, first thing you do, ice, elevate. After 20 minutes, if still not better, gabapentin. And if after 20 minutes after that, still not better, go ahead and use one of the last resort narcotic medications. And then finally, the last pain spike that we notice, and we typically see this in about 10% of our patients, is typically seen around 7 to 8 days after the operation. The reason why? That's where our studies have shown that swelling is actually the highest after the operation. At that point, the blood that was in the knee slowly starts to move down the leg. It leads to bruising, it leads to this tightness sensation. So don't be afraid and don't feel like you need to jump and take the narcotic medication immediately. Again, stop your exercises, elevate your leg, ice on it for 20 minutes, still not better, gabapentin, ice again, and if it's still not better after 20 minutes, then again, one of those narcotic pain medications. I hope this answers some of your questions about your postoperative pain regimen, and please feel free to reach out with any questions or concerns to my office if I can help in any way. Thanks so much.